I'm Andre Petroski. I'm a father, a fighter, and I'm in recovery. I'm at Caron today to get some answers as far as what's going on inside my brain and what my future looks like.
It's not a moral failing, it's a brain disease that affects the rest of the body. We can really target the treatment of the patient.
So the name of this 10 to 14 day assessment called the Neurocognitive program, purely assessment where we're taking a deep dive into the individual's health and wellness.
Here at Caron, we are unique in the sense that we're treating the whole patient. The history part and the physical exam is extremely important. Right after the history and physical, we're actually doing lab work, and it's important in being able to specifically target the treatment for the patient.
Where we also come in and why it's so important for the neuropsychological piece. Combining all of it in the neurocognitive piece, the biological piece, and why we look at the medical piece all together and comprehensively is to understand somebody's full history and the why behind what they do, who they are, and why they use. Neuropsychological testing is a comprehensive look at both cognitive functioning in different domains of the brain and also emotional, psychological, mood functioning simultaneously.
I have done damage to my brain between fighting and my history of substance abuse.
I don't think I'd ever see my brain activity in real time.
When someone comes in to do the QEEG evaluation, ultimately the goal of the assessment is to look at someone's resting brain activity.
And we call it neuroplasticity, the ability to change its structure and function in response to experience and/or injury. And then we're neuromapping the patient with electrical activity to see if there's any connection deficit in the brain.
Looks like a little swimmer's cap, and we use a little bit of a water-based gel that goes in 19 sensors. This is a non-invasive assessment, and what that looks like is a 20-minute recording. Do 2 recordings. So we record for 10 minutes with their eyes open, and then do the same thing with the eyes closed. Right after that, once we get good data, we look at it, we edit it, and we analyze it. Our goal is to get these assessments done in an efficient time manner to allow each discipline to get together and review the testing results.
History gives us information, and Andre, with the traumatic brain injury, that's a real thing, and it can affect the blood flow in the brain. And if the blood flow is affected in the brain, then that can alter multiple systems, including critical thinking, forward thinking, impulse control, even mood and memory. Everybody talks about personalized care. We have personalized care here.
I would imagine my daughter is going to ask me why I was in Florida this week, and I would explain to her that my career and my life leading up to this point has put my mental health and my brain health, my physical health at high risk, and that this was a preventative measure to gain knowledge and expertise on how to live a long, healthy, and productive life, even with Daddy's career being so dangerous.